Hello guys, welcome back again for our last part of 2019 Krok1 exam, right? And let's start from question number 151. That is, you're a 40-year-old woman dies of intracerebral hemorrhage. After the hypertensive emergency during an autopsy, the pathologist reveals a severe obesity, excess of body hair, and wide pulpous stria on the abdomen, right? A microscopic examination of pituitary gland reveals hyperplastic acini populated by homogeneous cluster of deeply basophilic cells. Which of the following are the most likely underlying disease? So guys, if I see from just like think about the clinical picture out here, that is what first is that is the obesity, right? Excess body hair. Thereafter there is also hypertension. Thereafter what is it guys? Like that's also the white purpose trial, right? So this leads me to think about the what Cushing disease, which I just mentioned out here. So like the punchline is like if whenever we talk about the Cushing disease, what is the basic presentation? That is about like about you say the 40-year-old man, right? Male or female, and like she's having what obesity she's having, right? Or like or he's having the obesity or she's having the obesity, right? Thereafter this kind of varices can be seen like this, or Vaccini you can say. Thereafter, like there is an increased level of ACTH is seen, right? So that's how I think about the Cushing disease, and this is what the clinical presentation of the Cushing disease. And what is here like see, so most of the guys I see like those are confused in the Cushing what disease and syndrome, right? So guys, like the first and foremost thing whenever you think about this thing, just think like okay, disease is related to the pituitary, whereas the syndrome can be directly related to the adrenal glands. That is it guys. So that's what we need to know about the Cushing disease and Cushing syndrome. But what you need to know is like there is increased production of ACTH in the Cushing disease. That's it. Okay, so now we have our answer, that is what Cushing disease. Thereafter, if we think about the hyperthyroidism, so there must not be what? There must not be obesity, right? There must not be obesity, should not be present out here, because hyperthyroidism may directly lead to what? Increased metabolism. And if there is more metabolism, there is more destruction of fats, and so there is what? A slim body, right? So that's what mostly seen in this hyperthyroidism case. Shihan syndrome, guys, it's totally different thing. This happens when after the paturation, when there is a lot of blood loss, right, in a woman. So what happens to her? Like there's a decrease blood supply to the pituitary, right? So in this case, like if you think about this, like what happened in the Shihan syndrome, there is no lactation, right? There is no lactation in the mother after the paturation. So here, first of all, we don't have any kind of the history about the paturation or anything like this. So no, this is not even near or even possible in this case. Again, the last one is the arterial hypertension, right? So in hypertension, guys, maybe like there is given some kind of more brief history about the hypertension, right? Or there may be given like the okay, like what whenever we talk about the arterial hypertension, maybe we think about the kidney, right? Either kidney, we think about the heart more often, right? So but like from the question itself, you can think about it like there is nothing related to the CVS system. There is much more about what? Endocrine. So it's a question of endocrine, right? Let's move to another question. That is what? An 18-year-old girl comes to her physician with concern about her health because she has not achieved menarche. So what is menarche, guys? That is the first menstruation, right? First menstruation. That's menarche. When what is the normal age of menarche? That is in females. That is what? About 12 to 14 years, right? And she's saying that an 18-year-old girl, she didn't had her first menstruation till now, so it's a big problem, right? So she also denies any significant weight loss. So there may be like nothing related to the endocrine pathology, right? So there may be, okay, so I can just we can just take a guess. So maybe there is no endocrine pathology out here. changes in mood or changes in her appetite. So there is nothing change in mood or appetite, right? She mentions that her mother told her about the mild birth defects. So right here we think about the birth defects out here, but she cannot recall the specifies. Okay, past medical history on and family are benign, so there is not much deep family history. On physical examination, the patient is short stature, has a short and webbed neck and a wide chest. Okay, so now we have our first clue. So what can be this, guys? This can be related to what? Turner syndrome, right? And but to confirm Turner syndrome, we must, which is like, see that, guys, what is the genotype of Turner syndrome, which we discussed just yesterday? That is what? XO, right? So we, what we discussed yesterday, so she must not have any what? Bar bodies, right? She must not have any bar bodies. Now we let's see the next line, that is what? Staining of buccal smear reveals the absence of bar bodies. Now I have confirmed diagnosis of the Turner syndrome. Easy. In the nucleus of epithelial cells, a urine pregnancy test is negative. Of course, which of the following genetic disorder is most likely the patient condition? So why we did the urine pregnancy test, guys? Because in pregnancy there is also no menstruation, right? So in pregnancy there is also no menses, right? So that's why we just did this test, and answer that's out here. That's the Turner syndrome. Whereas if we think about the other syndrome, that is what? Klinefelter syndrome, that must be what? XXY. Cridocytitis must be trisomy number 5th chromosome, right? Plateau is 13th chromosome, Edward is 18th chromosome, right? And like the most of these things, right? Like except I would say the Klinefelter syndrome, we don't have any further pathology of the reproductive system, right? Only these two are concerned out here. And again we have our the spot out here, which is what? Absence of bar bodies, right? So if there is a female, right, and she is absent, she doesn't have any bar bodies, so that must be what? Turner syndrome, which we think about, because she is having the normal autosomes, plus she is missing one. She is missing what? Sex chromosome. That is it. Okay, guys. Next question. That is what? A 56-year-old man presents to a checkup. The patient says he has to urinate quite frequently, right? But deems any dysuria or pain in urination. So what he is saying, like, okay, so maybe like he need to urinate about let's say 8 times a day, 8 times a day, or let's say it's better to say like even a higher amount of number, because okay, for just sake of this question, let's say 16 times per day. Okay, past medical history is diabetes mellitus type 2. That is itself a good history, because why? In diabetes we have increased urination, right? Increase urination. And hypertension is also there. Okay, both managed medically. Current medications are metformin, which is the first line drug of diabetes mellitus. Aspirin for what? For okay, let's see the history again. So there is no pain in urination, so okay, like let's just leave the aspirin for the moment. Rosuvastatin, again this is statin category drug, which is for the what? For decreasing the lipids, right? Captopril. Captopril is for what? Captopril is your ACE inhibitor, right? Which we discussed this yesterday. That is your ACE inhibitor. And furosemide, which is this. Furosemide is a loop diuretic, right? Loop diuretics. So the increased urination can be due to the loop diuretics also, right? Laboratory findings are significant for the glycated hemoglobin, which is 8%. Okay, little bit increased. Fasting blood glucose is 12 millimole per liter, is also very increased, right? The doctor decides to add glibenclamide. What is glibenclamide, guys? That is the drug from which category? Sulfonylureas. Sulfonylureas category, right? So this is basically given in what? In the diabetes mellitus type what? 2, right? Which is like, what is the function of sulfonylureas, right? To increase the sensitivity of insulin receptors, and also to increase the production of insulin, right? So let's see which one of our option is more appropriate out here. This is again a question of which, guys? It's a question of endocrinology. right? But like I just feel that these questions are really like big questions, right? So these are really lengthy questions out here. Okay, so let's see what is the okay, let's see the options out here. What is that? Is what inhibition of insulin release? No. Why should we inhibit the insulin? That's totally wrong answer. Stimulation of glucose uptake by the cell. So this is work of what? This is a work of insulin, right? And we are not giving the insulin. We are giving what? Glibenclamide, right? Glibenclamide. So it's not right. This option can't also be possible. Facilitation of glucose absorption by the intestine. Well, again, this is not any appropriate answer option itself, right? So what is that? That is what stimulation of the insulin release, right? Next question. A 68-year-old man comes to his physician with complaints of severe fatigue and altered sensation in his extremities. So there is maybe some altered sensation, so he's not able to feel very well, or he's not able to perceive what sensory information, right? So sensory information is deprived. For example, let me just say out here, past medical history is remarkable for chronic gastritis, right? So what can be happening out here? What I can know, what I just think about here, maybe due to some chronic gastritis there is less secretion of intrinsic factor, maybe, right? And so therefore maybe there is less production of vitamin B, there's less vitamin B12, maybe, like, okay. Let's see what's more out here. He drinks alcohol almost every day. His blood pressure is about little bit elevated. Heart rate is again okay, little bit elevated. Respiratory rate is normal. Temperature is again normal. His heart has regular rate and rhythm. Okay, so heart is totally normal. His lungs are clear to auscultation bilaterally, so there is no defect in the lungs also. Neurological examination reveals loss of touch and vibration senses in both upper and lower limbs. Okay, so again we have a neurological question. So this is the question of neurology. Lab investigation include a hemoglobin of 80 gram per liter. So patient is what? Anemic, right? Thereafter the MCV is increased, mean corpuscular volume, that is increased. So that's what we talked yesterday, right? So what is what? These are what? Megalocytes. These are megalocytes. The white blood cells is again okay, it's about normal. Which of the following is most likely diagnosis, which we just talked about? That is what, which we think is right, vitamin B12 deficiency. See guys, like once you even like read the question, you sometimes you get yourself the answer, right, without even looking at the options, right? Okay, next question. On physiology class, the professor asks about your report about the various effects of body hormones and neurotransmitters on the metabolism of glucose. You begin your report with a statement that use of glucose by the cell is preceded by absorption through the plasma membrane from the extracellular matrix into the cell. Which of the following hormone is responsible for glucose uptake by the cell? That is what? Insulin, right? Why it's insulin, guys? See, insulin is what? A fed state hormone, right? It's a fed state hormone. It's a fed state hormone. So what it does is, see, it stimulate the process of glucose uptake by the cells, right? So that's right, when there is a more glucose in the body, only at that point insulin will get released from the body, right? So that's why we have answer as insulin. And if you see here, right, like the two major hormones which are directly, or three major hormones which are directly related to the glucose level inside the blood plasma, right? So that is what insulin, glucagon, and epinephrine, what I can see. Okay, so insulin is a fed state hormone. That is why, like, we just got this answer. Glucagon is what? A hunger state hormone, right? A hunger state hormone. So when the glucagon gets stimulated, the insulin must get inhibited, and vice versa, just like that. Okay, and epinephrine is what? You all know what it is. What? A sympathetic hormone, right? So it's a sympathetic hormone. Whenever it gets activated, it will activate what? It will activate glycogenolysis, so that it will what? It will break down what? Glycogen, so that the increased level of what, guys? Increased level of glucose inside the in blood plasma. right? Thyroxine and aldosterone are not even related altogether, because see, thyroxine is what for our basal metabolic rate, right? And aldosterone is for, again, we just discussed yesterday, so it's not even related for this question out here. Remember? Right. Next question. After dehelminthization, a 35-year-old man passed a 3.5 meter, so that much big, what? Tapeworm. Oh my god. During a bowel movement, a stool examination revealed scolex with 4 suckers and hooks. Oh my god. So this is a clinical presentation of, guys, what? Teniasis. That is it. Teniasis. That is it, guys. Mature procliditis are category with 12 primary uterine branches. Which of the following are most likely diagnosis? That is what? Teniasis. That is easy, right? And we talk about all of this organism in our last lecture or in the last class. You can see the videos like when we talk about what? About 101 to 150 questions, right? So we just discussed very beautifully about this whole topic. And if you want to just like see the picture of teniasis, I just drawn this for you. So it's having this, like, this is 1 2 3, and there is 4th sucker on the back. You can say, okay, let me just make it out here. So it is having the 4th sucker like there, and from where we can just get, like, there are 2 species of teniasis itself. One is teniasis solium, right? And there is another species of teniasis. So, like, one of these is found in the pigs or the pork, and another is in the beef, but both share about the same morphological character. That is what these are having the 4 suckers out here, right? So this is an important thing to remember for you guys. Remember. Next question. Right. A 16-year-old girl concerned about her sexual development. Okay, let me just zoom in the question for you guys. About her, a 16-year-old girl concerned about her sexual development comes to the physician. She mentions that she has still not had a menstrual period. So, okay, she didn't had any menstruation till the 16-year-old. Oh my god. Okay, so she must had the menstruation. We just discussed it about the age of 14, right? However, she is otherwise a healthy girl with no significant medical problems. On physical examination, her vital signs are stable. She doesn't have pubic hair and her breast is slightly elevated with the areola remaining in the contour with the surrounding breast. So she didn't had any development of the secondary sexual characteristics, right? So first of all, which subject's question is this, guys? This is what? Reproductive, right? Reproductive system question, right? So she like, what we can see here, like, what I can just think in my mind about, like, the about the question which is given out here. So like, she must be having some hormonal problems, right? Hormonal problems, right? Which of the following is most likely case of her abnormal physical development? Okay, so hyperthyroidism, no, this can't be possible, right? Right here. Pancreatic islet insufficiency, that can cause what? Diabetes, but there is no diabetes thing. Hypothyroidism, again, we must have enough history of the hypothyroidism, such as obesity, right? Which we just discussed. Adrenal medulla hyperfunction, no, this can't also be possible in this case, because then it will be like having some, we must be having some Cushing thing, right? Cushing's disease may be possible out here, or like there must be no increased sympathetic part if the adrenal medulla get hyperfunction. But leave this thing, we are not concerned about this details for this question. So the only thing which is possible out here, that is what? Ovarian insufficiency. Now, discuss how can it be ovarian insufficiency itself. See, guys, so what ovary does is it produces hormones such as what? Estrogen and progesterone, right? And these are what? These are the sexual hormones. These are the sex hormones. And if there are not like this kind of hormones, like this kind of hormones are not released from the ovary itself, so there there is no development, right? There is no development of sexual characteristics, right? So this is the point out here. So if the ovary is not even working, so how can these features get developed? So it's impossible to develop this feature without the working of ovary, right? So that's why there is what? Ovarian insufficiency. But again guys, like there can be other option possible, which is what, like maybe there is pituitary, like pituitary defect can also be possible in this case, but still we don't have that, we don't even have that option out here, so only this is the possible answer, right? Next question, that is what, a 23-year-old woman complaining to the emergency department of what, of bloody diarrhea, okay, fatigue and confusion. A few days earlier, she went to fast food restaurant for a birthday party. Her friends are experiencing the similar symptoms. So, guys, what is what? This is what? This must be our, like some question related to the first of all, this is related to the microbiome, right? Microbiology. Thereafter, like what is directly related to, like we can just think about it. Okay, so the if the whole group is affected, so there is nothing, only only wrong with the woman itself, so it's wrong with the whole group. And what is the common with the whole group? That is what, so they all went to a birthday party, so like they must have eaten some bad food, right? So they must have eaten what, some bad food. Let it be. Laboratory studies shows anemia. Okay, why there is anemia, guys? Why there is anemia possible out here? But I can think about it. See, there is bloody diarrhea, right? If there is less blood in the body, what is going to happen? It lead to the formation of anemia, right? It's easy. Which of the following would you most likely obtain for the microbiologic testing? See, guys, what is she having? First of all, where is she having the problem? She's having problem with the what, GI tract, right? She's having problem with the GI tract, and even specific with the GI tract, she doesn't have any problem with the upper GI, right? She doesn't have any problem with the upper GIT, so she's just having a problem with the lower GIT. So either like that is the most probable way to find the microbe itself, right? So where it should be located, it must be located to the part which is more infected, that is what, lower GI. And what is that, like what, okay, what specimen can we obtain from the lower GI part? That is what, either we can do biopsy, right? But for this, like a small thing, it's very, not it, I will say, even illogical to do a biopsy itself, right? Because biopsy is more frequent for maybe cancer detection, right? And the polyps detection, or to like just study the polyps out. So there's nothing like that in this case, right? So we must get what, we must get stool sample, right? It's even a common sense out here in this question, right? So what is that? That is what, stool. Urine, when can we collect the urine, guys? It may be during a time of UTI, that's better. CSF, when there is a sign of meningitis. Bile, when we can say, like the gamma, like the gamma streptococcus, maybe at that time we can think about the bile itself, right? And in the blood, well, if there is some, like the microbe may be present in the blood or not, so it can also be a method. But like the most preferable method out here, that is what, stool sample, right? Easy. Next question, after delivery of a child by pregnant woman, the midwife notices defect in the external genitalia of a newborn. This is a very good question, because that's what we do, guys. Like even in the gynecological department, right, whenever a baby gets born, first of all what we need to check is, okay, so the baby is having fingers, right? So we just say, okay, 5 fingers, and like thereafter we see on the toes, okay, like the baby is all having all the fingers, right? And thereafter we see all other features of the baby itself, right? So one of them is also like to check out the genitalia. And there what she noticed is, the woman only had one prenatal ultrasound that reported a male fetus, so it's a male, right? So it's a what, it's a male, right? On physical examination, the neonatologists, okay, so these are the specialists for the neonates, notices a short, broad penis with the orifice on its dorsal aspect. Okay, so if we just imagine this thing, what they are saying is, for example, okay, so what they are saying is, maybe what this is, there is a orifice on its dorsal aspect, right? It's what, dorsal aspect, let's say out here. Both testicles are present in the scrotum, right? This is also we check. Which of the following is the most likely congenital abnormality, right? So what I can think about is here, see guys, if whenever you have this kind of question, right, we must know about these 3 4 words: epispedia, hypospadia, right? So epispedia means on the above, right? Maybe present out here, maybe. That is what epi. And if it's down here, that is what hypospadia, right? So that's what we need to concern about, right? And which of the following is most likely congenital abnormality? Well, okay. So let's again just see, where is it? Short, broad penis with an orifice on its dorsal aspect, right? So ventral is what? Anterior. Dorsal is what? Posterior. So if we think about it, right, so it must be about, I would say it must be hypospadia, right, rather than the epispadia. So I think this is the better answer, right? So hypospadia is the best answer. So I don't think epispadia can be the answer, because as I just discussed out here, right? So female says no, it can't be answer again. Over testicular disorder, sex development, nah, we just need to more focus on where is the orifice, right? So if it's above, that's epi, right? If it's down, it's what? Hypospadia. So there is not of a rocket science out here. Next question. A mother of a 4-month-old male infant brought him to pediatrician with the complaints of food rejection and weight loss, right? This usually happen with the children also, because they used to reject the food whenever they have any kind of disturbance, right? Next part, let's see, what is that? He started having trouble lactating, okay, latching onto the bottle. He has also become very lethargic, okay. Examination revealed diminished muscle tone in all 4 limbs, so it must be what? Some central problem, or maybe there is some metabolism problem. And hepatosplenomegaly, okay, now we are getting something. Maybe what is the age again? Let's see. Oh my god, only 4 month old. 4 month old 4 month old child, right? So it must be related to some genetic disturbance, right? And here we are having what? Hepatosplenomegaly also. And ophthalmologist exam reveal macular cherry spots. Okay, now we can just think about 2 disease. That is what? Your Tay-Sachs, right? Tay-Sachs disease. Or we can think about what, guys? We can think about Niemann-Pick, right? Niemann-Pick disease. Pick disease. And both are sharing what? A common feature, that is what? That is what? They are having a cherry red spot on the macula, right? And what is the difference between these guys? There is only one major difference, which I would say. The Tay-Sachs disease, right? The Tay-Sachs disease is not having, it doesn't have hepatosplenomegaly. Splenomegaly. Whereas Niemann-Pick is having hepatosplenomegaly, right? During next few weeks, hepatosplenomegaly progress, right? The body fails to thrive. He continues to reject food. Chest X-ray shows a reticulonodular pattern and calcified nodules. Biopsy of the liver shows foamy histiocytes, right? That must be present out here. This is also one of the clinical presentation. A Niemann-Pick disease, right? We were right, guys. That was the Niemann-Pick disease. And what is it? See, guys, what is the, like, let me just tell you, right? What is the enzyme deficient in this thing? In the Niemann-Pick disease, right? Think about sphingomyelin. Sphingomyelin is enzyme is what? Deficient. In the Tay-Sachs disease, what? That's the hexominidase A. Hexominidase A is deficient. Easy, right? So now we have what? Niemann-Pick disease, and in the Niemann-Pick disease, what is absent? It is what? Sphingomyelin is, right? So his sphingomyelin is the answer out here. Easy, guys, right? Let's move to the another question. That is what? A 6-year-old boy is brought to the pediatrician by his mother, who complains of low-grade fever, chronic cough, and night sweats in her child. She described the cough as productive, producing white sputum that is meat times okay, that is sometimes, maybe, right? It is sometimes streaked with blood. She also says that her son has lost some weight in the last month. His vital signs include blood pressure of 115 above 75 mmHg, heart rate of 110 per minute, respiratory rate little bit high. No, that's normal. It's normal. Heart rate is little bit high. Blood pressure is, I would say, about to normal. Temperature 36.6. Okay, little bit down. Oh no, it's normal again, right? It's normal. On physical examination, the patient is ill looking. Pulmonary auscultation reveals some crackles in the right upper lobe. So here we can suspect what? We can suspect pneumonia. Let me just say, okay, we are suspecting, right? It's not the diagnosis, it's what? Suspicion. So suspicion out here. The pediatrician suspects an active infection and perform Mantoux test, right guys? We just discussed Mantoux test in the last video. That is what? For the tuberculosis, right? For the tuberculosis. Intradermal injection of which of the following substance has been likely used by pediatrician for the screening test in this case? We also discussed this, guys. Which of the following substances injected in this case? That is what? Tuberculin, right? Tuberculin. So that's why it's known as what? Tuberculin skin test also, right? Tuberculin skin test. Okay, again now we have our answer. Thereafter, BCG vaccine. Well, it's simply not any kind of vaccination which we give under the dermal. No, that's like no. So okay, like we don't give vaccine, right? Intradermal. This vaccine specifically for this test. That is it, right? DTP vaccine. No. Why should we give DTP? No. Again, not even related, right? So this is the only one which is related to the tuberculosis, specifically with this test, which is what? Mantoux test. Mantoux test. Right. Next question. And okay, next question is, a 65-year-old woman presents to the emergency department because of the shortness of breath and chest pain that started a few hours ago. So maybe there can be possibility of angina. I can just think about it. Okay, angina, maybe. She didn't have a fever, expectoration, or any accompanying symptoms. She has a history of right leg deep vein thrombosis. Oh my god, that occurred 5 years ago. Now we have a very beautiful history out here. See, students, what's going on in this patient? That is what? See, maybe this is okay. Let me just make a rough rag out here. And if there is a vein out here, let me just try it again. For example, there is a deep vein out here and there is a thrombus out there. Again, that is what is in the history, right? So what is going to happen is, sometime later, she dies of severe respiratory distress. A pulmonary autopsy specimen reveals a red loose mass that is lodged in the bifurcation of pulmonary trunk, with the extension into the both left and the right main pulmonary arteries. Which of the following is most likely diagnosis? See, guys, before reaching to this question again, let me just tell you one thing. What is it? Vein carry blood to the heart, right? For example, let me just make a heart out here, because see, veins are having a lot of big diameter, right, as compared to the arteries. Okay, so maybe the blood is now reached to the heart. Again, at which part of the heart the blood will get drained from the vein? That is what? Right atrium. Thereafter, from the right ventricle, it again gets pumped out to the what? To the part of guys, that is lungs. Again, right, lungs, that is lungs. And may be possible, right? See, because now at this point they are having very big diameter, right? So they are having big diameter in the heart also, in this big vessels also, right? But see, as soon as maybe like this clot may get up there in the right atrium, thereafter from the right ventricle it get travels to the lungs, and from the lungs, right, when it's coming to the heart, maybe it gets lodged somewhere out there, and that is causing what? Respiratory distress syndrome, right? So let's look at the options now. Right, what is that? Pneumothorax? No, not even possible with this history. Pneumonia, again not possible. Myocardial infarction, well, this can be possible in this case, like when there is angina case, or we had the history of atherosclerosis, or we just had it's lodged in the heart. No, again it's not the question out here. So only left it with the thromboembolism. Why? See, even the question is also saying the thrombus. We had the history of thrombus, and maybe what happened is this thrombus gets traveled to the heart, thereafter to the lungs, and maybe in the lungs also, right? Only in the lungs even it is causing the what? The respiratory distress syndrome. So what is that, guys? Like the thrombus get embolized in the arteries out there. Okay, so that's why this is the answer out there. Easy, right? Okay, the next question is, a 14-year-old girl presents to the emergency department for the evaluation of the infected leg. Okay, she states that there is no history of trauma, but mentioned that she had a history of sickle cell disease. Oh my god, she's having what? Sickle cell anemia. That is, let's say. On physical examination, the upper part of her shin is very painful. Okay, red, swollen, and hot. Her temperature is about 39.2 degrees Celsius. So she is having what? Fever. She is having fever. An X-ray shows focal bony lysis and loss of tubercular architecture in the metaphysis of the right tibia. What is happening out here, guys? See, let me just make a rough diagram out here. What is happening? Maybe okay. So maybe this is the tibia, right? And what is happening out here, right? So there is a less density in metaphysis, the metaphysis, right, which is given in the question itself, right? So there is a loss of tubercular architecture in the metaphysis of the right tibia. Okay, for example, it's just get lost out here, for example. Let me just say. So what we need to think about it, right, guys, that is what, maybe there is even like problem with the development maybe of the bone, or maybe there can be possible is there is more destruction of the bone, right? So both of the cases are possible. Both increased destruction of bone is possible out here. There's increased activity of, okay, now it's given like which of the cells activity is increased out here that can cause this thing. And we know that we have two kind of cell for which are responsible for the bone making, right? One of them is responsible for the bone making and one is responsible for the breaking of the bone. Breaking of the bone means to decrease the density of the bone, right? That is was osteoblasts and osteoclasts, right? Osteoblast and osteoclast. So these are what? Bone making. These are what? Bone, I would say bone eating cell, right? Let's say that, because that's easy to think about, right? So these are bone making cells, bone eating. So if the bone eating cells get increased, maybe, right, maybe that is the case of decrease bone density. Okay, that is, let's see the questions now. Okay, chondroblast, no, these are the what? These are the cells which form cartilages. No, we don't have any problem with that. Osteocytes, no, again. Osteoblast, no, we don't have any problem with the osteoblast. Chondrocytes, again, with the cartilage, we don't have any problem. We have the overworking of osteoclasts out here, right? We just discussed out here osteoclasts, right? Next question, guys, that is what? A 46-year-old man presents with the fatigue and joint pain in his fingers and wrist for the last 2 months. The pain is present in the both hands and the wrist are swollen. Okay, he described morning stiffness in his joints about 2 hours. I can think here about what? Either it's, guys, arthritis or it's gout, right? Let's see what is happening out here, which improves with use. The past medical history reveals he has been successfully treated with the H. pylori related ulcer last year. He denies smoking and stopped drinking when the gastric symptoms started. Which of the following drugs is the best choice for the joint pain management, guys? Like we treat both arthritis and gout. Like as the for the pain treatment, we use what? NSAIDs, right? And again, the NSAIDs, like we used what? Mostly like the selective COX-2 blocker, that is the most preferred one. And what is the name of selective COX-2 blocker? That is what? Colexib, right? That's why we have our answer as a Colexib. But see, other drug can also be used, right? There is no doubt in that thing. But like the most preferred for the pain management in the arthritis and gout, that is what? Colexib, because it's a selective COX-2 inhibitor. And again, one more thing, guys, that is what? The patient is already having the history of peptic ulcer disease, right? So maybe maybe like this ulcer may reoccur if we give the non-selective cox blockers, right? Non-selective cox blocker can increase the risk of ulcers. Why? Because see, this will inhibit the prostaglandins, and prostaglandins also serve as the protection for what? For our GIT tract, right? So that's why we can also go to this conclusion on the collexive. Easy. Next question. A 45-year-old woman comes to her physician with complaints of excessive fatigue, okay, and weakness. She says that these symptoms have been present for over past month. On further questioning, she admits that she lost 3 kilograms in last 2 weeks. Okay, she lost 3 kilograms in last 2 weeks. On physical examination, she is a tired appearing thin woman. Hyperpigmentation is present over many areas of the body, most prominently over the face, neck, and back of the hand. So, what is the cell which is responsible for the pigmentation? That is what? Melanocytes, right? Melanocytes. Increased production of which hormone is most likely cause of hyperpigmentation in the patient? Well, which hormones are responsible for the pigmentation? That is what? Melanocyte stimulating hormone, which stimulate the melanocytes, and finally the melanocytes will give what? It will give color. Right? So what is color? That is what? Pigmentation of the skin. Pigmentation of the skin, right guys? So that's how we think, like, okay, it can be what? Melanocyte stimulating hormone. And again, if you will see the other option, thyroid stimulating hormone, no, it will not have any effect on the color, right? Gonadotropins, again, how can gonads help with the color? Beta lipoprotein, again, no. Growth hormone will not have any effect on the color, again, right? Next question. 38-year-old woman who was diagnosed with the SLE. We had just question of SLE yesterday, right? So just remind me, guys. Okay, just write in the comment box, what is the presentation of the SLE in the kidney, right? When we can say, okay, what is the specific marker of a kidney, like whenever we say, okay, there is SLE in this kidney. Okay, just write down in the comment box. 3 years ago, comes to her physician with a complaint of facial swelling and decreased urination. She first noticed 2 weeks ago. She currently take azithromycin and corticosteroid. Okay, her vital signs show blood pressure of 150 volts, hypertension. Pulse again is increased a little bit. Respiratory rate is totally normal. Temperature is also totally normal. On physical examination, the doctor notices erythromatous rash and butterfly pattern on her face, which is also the diagnostic feature of SLE, right? Remember, studies reveal hypercholesterolemia. Okay, this increased cholesterol, hypertriglyceride, and proteinuria. So this is the easy one now. Which of the following is most likely mechanism of the SLE's complication in the patient, right? We just discussed it in the last video. What is what? In the SLE, what are these, right? This is what antibodies get produced, right? And this will attack what? This will attack kidneys, right? Kidneys. And in the kidneys, when they attack, right, they will form what? Like they will form some immune complex, and they will finally lead to what? The glomerular. They will destruct the glomeruli. Gets killed, or let's say. And due to, if the glomerulus get killed, so there is what? More space. If there is more space, then the what will happen? The protein can easily escape in urine. So that's why we are having what? Proteinuria also, right? And also it's what? Immune complex mediated disease, right? And this is what kind of hypersensitivity now? If it's like this, it's type 3, guys. Okay, and I think we just discussed in one of the last videos, but still I'm just telling you again. It's a type 3 hypersensitivity. Increased plasma oncotic pressure, well, it's not possible because we are having the proteins in the urine, and there is nothing like there is less protein in urine, something, no, nothing like that. Decrease in renal blood flow, well, no, it's not even possible in this case. Acute infection to the kidney, well, it must be having some other features such as the increased WBC and that count itself, right? So it's not even possible other options, right? 64-year-old man presents with a tremor in his legs, and he says he has a tremor for many years, okay, but worsened in the last year. Tremor is more prominent in the rest and nearly disappears on the movement. Oh, so it's a clinical presentation of, guys, well, that's a presentation of something, okay, from like this is a deep neurology, but still this is a presentation of the Parkinson, okay. But for you guys, you don't need to know that much about it, okay, because like this is the way we can also differentiate between many diseases and the Parkinson, but still, okay. And what is that? His daughter mentions that his movements have become slower. The patient is afebrile and vital signs are within normal limits. On physical examination, the patient is hunched over and his face is expressionless. So he is having what? Mask-like faces, right? Throughout the examination, there is a pill rolling tremor, right? So this is again, guys, the clinical feature of Parkinson, right? So here, this must, like this, if there is a pill rolling tremor, this is in case of Parkinson. And again, this is a question of what? Neurology. Right? This is accentuated when the patient is asked to clench the collateral hand by elevated by finger nose testing. When doctor, we don't even need to know that much about it, but still you just know what is the treatment of the Parkinson. That is what you must know. That is the carbidopa plus levodopa. For the Ukraine standards, you must be more concerned about the levodopa, right? So that's what levodopa. And again, what is like, okay, now for this question he is asking a second step question, that is what is the mechanism of the levodopa? That is what levodopa even itself, what is it? It's the L dopa, I would say, and it's stimulating what? It's stimulating the dopamine receptors, right? That is the first work. And if I will say just like the sulfonylureas or the glycosamine, as I just said, right? So it's also stimulate the dopamine production. If we don't have the dopamine receptor will get start working more, then we must have what? Stimulation of the dopamine production out here, right? That is what it is. Cholinesterase inhibition not possible. Again, M2 cholinergic, no, it's dopamine, it will not like that. It will act on what? D receptor. Inhibition of M2, no. Again, we just have the direct answer question out here. A 24-year-old man undergoes surgery. During the operation, the organ excised has sent to the histological evaluation. A light microscopic examination reveals the organ enclosed by the connective tissue capsule. Okay, so there is a capsule which is enclosing this or connecting this organ that enters the substance of lobes that enters the substance of the lobes to further divide the organ into irregular lobular units. So this organ is having lobes, right? Let's say like this. Each lobule consists of cluster of follicles filled with colloid. Okay, let me just say things like this. Okay, let it be like this maybe. Follicular epithelium consists of low columnar, cuboidal, or squamous cell depending on the level of activity of follicle, right? What of the following organs? Well, that's easy now. That's thyroid, because only thyroid is having this kind of follicular arrangement, right? So that's the easy question. It's from the what? It's histology. If the parathyroid gland, if we think about it, must be having what? Follicles, but it must be located on the periphery of an organ. That organ is what? That is what? Thyroid. Next, parotid gland. Well, it must be having a different type of epithelium itself because it's secreting more. What it's secreting? Your saliva, right? Thymus. Well, it's again. This must be having like different presentation. So pancreas must be having more kind of what, RER, for example, right? And for the thymus we must have what, like this is a like okay organ which is present in children until the 14-year old, something like that. But again, this is kind of the answer itself. So again, the thyroid gland is the only possible answer out here, right? Because like whenever you read this kind of question from the histology section, right, you just like make an imagination. So okay, maybe there is a connective tissue like this. Okay, so there are follicles inside it, and now we have like very few organs itself which are consisting of follicles like this. Okay, maybe there is maybe lymph nodes present, but again the lymph node are not filled with the colloid substances, right? So they are not made of this epithelium itself. So that's how you can just differentiate out this thing inside your own mind, right? Next question. A 37-year-old female presents to the clinic complaining of severe pain in her left wrist and tingling sensation in her left thumb, index finger and the middle finger. So guys, we just discussed it in the like no last to last video. What is that? Like we discussed about the sensory innervation of hand. So what is that, guys? Just like what is she saying? Okay, maybe okay, 1 2 3 4, and this is the thumb, let's say. So and this, okay, this part is mostly innervated by median nerve, right? And this is by what? This is by ulnar. Easy. The pain occupational from she could do more take ibuprofen, but now pain is much worse. Wakes up at night. She work as a typist. Okay, so here it will become a big problem out here for her. Her pain mostly increases after typing all day. Her right wrist and fingers are fine. Okay, so it's what, unilateral pain. Nerve conduction studies reveal nerve compression. Well, okay, so what is that? Okay, so what is that compression? Let's see. Which of the following nerve is most compression? The most likely compression in patient. That is what, median nerve, because of the history we know, right? Because these fingers are affected the most out here, right? That's easy. And again, guys, like I just want to mention out a word here. That is what, carpal tunnel syndrome. Maybe you heard this word. Well, carpal tunnel syndrome. Maybe the woman is suffering from this disease. Then this what happened? Like the median nerve gets compressed, right? So this is what the carpal tunnel syndrome is. Let's move to another question. That is what, a 37-year-old man is admitted to the hospital with the mental confusion and the disorientation. His wife reports he became more irritable and forgetful in the past year. In addition, she notes that he became a vegan a year ago. Oh, so now we just had this thing out here, vegan. So he must be having deficient of what vitamins, guys? It must be he must be having deficiency of vitamin what, B12 out here. Maybe possible. Let's see. Currently, his diet consists of starchy foods like potatoes, corn, leafy vegetables. GI symptoms include anorexia, diarrhea, and vomiting. He has glossitis and skin lesions. Well, that's a symptom of vitamin B deficiency, like vitamin B complex deficiency itself. Okay. Appear vesicle on the extremities, eczema like conditions around the mouth. So that is colitis, right? So colitis is due to vitamin B2 deficiency, as well as discrimination in the roughened skin over the hands are also present. So he must be having what, something, like maybe vitamin A deficiency. Like okay, I'm telling on the basic of the vitamins, but again, neurological examination reveals systematical hyposthesia and are all type of sensation in both upper and lower extremities in a glove and socks distribution. So it lies like the deficiency of which of the following amino acid. Okay, now he is asking about the amino acid, not about the vitamins itself, right? So what vitamins are deficient in this case? That is what, lysine. Why, guys? Now I will must discuss. Like let's just use the termination method out here. Histidine will produce what, histamine. So in this is mostly involved in what, in the hypersensitivity reaction, so that's why histidine cannot be the answer. Arginine is the an essential amino acid for the children, and like this is basically used for the production of nitric oxide, but again this is used in the vasodilation, but again there is no use of that. Tryptophan, it's for other functions such as like producing other hormones, like yeah. So tryptophan can also not be the answer, because this can be deficient if you take what, if you take only corn based diet, on the corn based diet. Okay. And threonine deficiency can also be very rare, right? It's also very rare because threonine is also mostly found in the leafy vegetables, so that's why we have the answer as lysine. Right. A 54-year-old woman has total thyroidectomy for the papillary thyroid carcinoma. 11 hours after the operation, she complains of tingling around her mouth. A physical examination, the trosso and the Chostek sign is present. Remember, guys, this is the sign for what? Hypocalcemia. This is the sign of hypocalcemia. Her condition rapidly deteriorates with the laryngospasm and the focal seizures. The surgeon suggests surgical dissection of parathyroid glands. So the following are most likely. Again, I just, because these are the signs of what? Hypocalcemia. This you must know. Hypocalcemia out here. An 11-year-old girl is brought to the doctor's office by mother who states her daughter has been weak and swollen face for 3 days. Mother states that her daughter had always been healthy and active until the initiation of the symptoms. Upon inquiry, the girl describes the foamy appearance of her urine. This is what, guys? This is what? Protein in urine. Okay, let's see what will happen. But denies blood in urine. Okay, urinary frequency at night or pain during urination. Okay, so there is no, like the frequency is also the normal, but there is also not pain during the urination. Right. Physical examination reveals generalized swelling of the face and the pitting edema. So here we have it. What edema we are having? So we must be thinking about what. So there is more protein excretion. So there is less oncotic pressure. So with this must be causing what, edema, right out here. Laboratory study shows proteinuria and the microscopic hematuria, that we must be thinking, right? Which of the following is the most likely case of the laboratory study of the urine? Increased hydrostatic pressure in the Bowman's capsule? No, we don't have any history regarding with that, not possible. Increased plasma oncotic pressure? Well, if the increased oncotic pressure, we must not be having this edemas, right? Increased glomerular hydrostatic pressure? Well, no, it's also not possible. Then we must be having increased urination itself, right? Again, not possible. Increased permeability across the glomerular capillary? Well, yes, that is the only possible answer. Why? Because this is the reason, right? If there is more permeability of the glomerular capillary wall, then we must be having what? Protein crossing, right? We must be having the erythrocytes crossing the wall, right? Crossing the wall and appearing in the urine. Right, guys? So that's why we have our answer as the increased permeability across the glomerular capillary wall. Next question, guys. That is what? A 60-year-old man with a history of hypertension, diabetes and hyperlipidemia had a sudden onset of right-sided weakness by the time the ambulance arrived. So what can it be possible, guys? Right-sided weakness. So it's what we can, okay, I can think it in a way like that is what? That may be hemiplegia. So what does the hemiplegia means, guys? This means what? The half body paralysis. Unfortunately, the patient died within the next 2 hours, and on an autopsy performed immediately, like the gross examination of the cerebral left hemisphere showed the brain swelling, widened gyri and poorly decarbonated gray-white junction. So that is what, guys, that is maybe necrosis, let's say. And this necrosis, if we say okay, this brain swelling, widened gyri and like no poorly demarcated, so this can be due to what? Ischemia may be present, right? Due to ischemia. So what can happen out here is we just forgot to discuss one thing, right? So what can be case of this sudden right side weakness, or what is the case of this sudden paralysis? Maybe, okay, let me just make, okay, this may be the carotid arteries, this is the internal, this can be the external one. Okay, so maybe what can be happening out here, there may be uh, uh let me just say, okay, maybe there is a thrombus traveling out here and it gets struck out here, right? So it will cause what? Ischemia. And finally, this is the patient is having the history of hemiplegia also, right? So we must think about the stroke also, right? So the ischemia and stroke is we can think about. And that is what here, ischemic stroke. Intracerebral hemorrhage, we must be having some hemorrhage on the when the autopsy is occurring, so it's not possible. Tumor, no history. Abscess only when there is some evidence of bacterial infection itself, right? Cyst, no history, right? Next question. That is what? A 43-year-old man seeks evaluation at the emergency department. The complaints of fever and chills, malaise, diffuse abdominal pain for over a week, diarrhea, and the loss of appetite. He says that his symptoms are progressively getting worse. He recalls that his fever began slowly and climbed its way up stepwise to the current 39.8 degrees Celsius. His blood pressure is about 100 above 70 mmHg. Physical examination reveals coated tongue, enlarged spleen, and rose spots. Right. So we have the question of what? I think it's a question of microbiome. Serological study agglutinin O, which is a agglutinogen for what? Typhoid. 1-200 by the Vidal test, so the test is confirmed out here. So always remember, guys, if it's about 1 above 200, that's what confirmation, right? Which of the following is the most likely causative agent of the patient's condition? That is what? Salmonella typhi, and also we confirmed it in the question itself. Remember, easy, right? So mycobacterium tuberculosis, now we must do some Mantox test, right? We just discussed it about 3-4 times now. Vibrio cholera, again we must be having some more diarrhea and other things like this. But like the enlarged spleen itself, like there are a lot of things, right? Leptospira and virulence, no, it's pyrophyte, not possible with this history. Enterohemorrhagic E. coli, again not from the Vidal test. So we see, like, that's the easy thing, right? So the typhoid fever can be confirmed with the Vidal test, and Vidal test is only specific for the typhoid fever, right? And that is what? Salmonella typhi, right? Next question. A team of medical students is performing research on the phase of cell cycle. During one of the mitotic phases, the cell is nearly done dividing. The chromosome decondenses and the two nuclei begin to form around them. So he's saying, okay, maybe there is cell like this. Let me just make a little bit big cell, for example, like this, right? So what he's saying, like, okay, they are studying the cell cycle, or in the cell cycle they are having what phase, guys? That is what? G1 phase, thereafter S phase, G2 phase, and M phase, right? And the M phase is itself having 4 phases. Which way is that? What? Prophase, metaphase, anaphase, and telophase. And there is also, like, some books also study that's the pro-metaphase also, right? So pro-metaphase also present, right? So what's going on out here? That is, okay, mitotic phases of the cell. So they are studying these phases of the cell, which is nearly done dividing. So the cell has divided. The dividing of the cell is taking place in the M phase, right? So let's just see in these phases what's going on. In the chromosome decondense and two nucleus begin to form around them. So it's showing, okay, so maybe something like this is happening out there. Maybe this is the two newly formed cells, maybe, and okay, and this is maybe the this is what here, the, like, there is like no nuclear wall, right? Oh, no, not nuclear wall, the cell envelope started forming around them, right? Something like this is what the last stage, right? So the last stage of the M phase itself is what? Telophase. right? That is the T phase itself out here, so telophase. Easy. So here we have the answer as what? Telophase. Next question. A male neonate born 24-year-old, okay, primary gravida, had jaundice at 8 hours of life. So it's what? Neonatal jaundice, right? The neonate's red blood cells was A positive, whereas the mother's type was O positive. The laboratory studies elevated filter of mother's A antibody, normal erythrocyte glucose is phosphatase, and negative sickle cell test. Hemoglobin was 106, so it's about, okay, like a little bit less than normal. Which of the following is most likely the case of infant in jaundice? So see, there is no, don't have any case of origin incompatibility, no decrease in hemoglobin, well, not that much, so that it can cause the anemia. Sickle cell disease, we just tested for that and it's negative. Glucose 6 phosphate dehydrogenase deficiency, we also tested for this and it's also negative. So we just have what? Hyperbilirubin in the child itself, right? So this is the only possible answer out here, right? Next question, that is what? An unidentified, okay, so there is unidentified surgical specimen is received for the histopathological analysis. A portion of the specimen is cut and stained with H&E staining, right, which is the most common staining for the pathologists, right? Under the microscope you can see an organ encapsulated, so there is a capsule around it, but dense connective tissue, okay, so it's just like this, for example. It extend to the deeper areas on the way of the tubercular extension, right, like this, okay, and it's also having some extension like this tubercle. The organ can be subdivided into two regions, a cortex and the lymphoid. Okay, now we know like it must be some lymph organ, right? So it can be what? Either it's spleen, lymph node, or what can it be possible, guys? Spleen, lymph node, and thymus, right? Okay, and medulla and the medullary cords are populated with the plasma B and T cells. So we also have, like if I think about the spleen, right, it must be given as, okay, if there is a cell of spleen, it must be having what? Central artery. So there is no history about that, so I can just eradicate out the spleen out here. And thymus also, right? So I don't think thymus is functioning for a long time in the human beings itself, right? Or in any animal. I think the maximum age for the spleen is about 14 years, right, in the child. So after 14 years you can see this, because the thymus gets atrophied itself after the 14 years of age. So again, like it is not having the the distension of the B and T cells, because thymus is only for the maturation of T cells, right, itself. So it can't be possible out here. Okay, so we have just left with the lymph node, and it's also having like this kind of separate. Okay, so maybe let me draw out here, may be possible. Okay, this is the place for the T cell, and inside this is a place for B cells, and this is what is happening out here also, right? Which of the following structure is most likely organ surgical development? Tonsils, again this is a type of lymph node, but it's not here. Spleen, again we just, okay, no thymus, no bone marrow, again lymph node is only possible answer out here, right? Next question. A 34-year-old man visits his dentist complaining of toothache. After dental procedure involved extraction of several teeth, he developed severe bleeding lasting more than 15 minutes. So he must be having some coagulation disorders, coagulation pathologies, right? So we must think about the deficiency of vitamin K out here, or we can think about the deficiency of some what? Protein, which is what about, I will say, the fibrinogen. Why fibrinogen? Why? Because fibrinogen is important for the clotting, right? That's why. He has a history of chronic hepatitis C, and we know that like the liver itself, liver produces a lot of proteins from it, from like a lot of the proteins are produced from the liver itself, right? So, and like one of them is what? Fibrinogen, and that's important for the stopping of bleeding, right, guys? So that's why I can think about what? Maybe the decreased number of fibrinogen, and that is the answer, hypofibrinogenemia. Hypoalbuminemia, no, it can't be the answer, because albumin will play no role. Albumin will play no role in the stopping of bleeding, right? Thrombocytopenia, well, if there is any liver disturbance itself, maybe there can be little bit effect, but there is a like no history dependent on the hepatitis C, so I will not say that. Hypocalcemia, well, there is no history enough to support this evidence again, so this is the answer, hypofibrinogenemia. Right. The next question is, a group of researchers aimed to study cardiac physiology found that overstretching of artery in the heart leads to the decreased sodium reabsorption in the distal convoluted tubule, because it will lead to the secretion of which hormone, guys? We just discussed about it. That's what, anti-natriuretic peptide, right? No, arterial natriuretic peptide. Sorry for the mispronunciation, guys. That is what, arterial natriuretic peptide, ANP. And increases the GFR. Okay, that is the work of the ANP, right? Because it will increase the urination. Cause of the physiological effect discovered by researchers. Okay, natriuretic peptide, right? Arterial natriuretic peptide. That's easy. 20. Okay, guys, let's move to the last question. That is what, a 20-year-old female comes to the clinic after missing her last 2 periods. Her cycles are usually regular, occurring by 28th to 30th day interval with a moderate bleeding and some abdominal discomfort. She also complains of progressively diminishing peripheral vision. Her doctor reveals loss of vision in the lateral halves of the both eyes. So let me just make a little bit diagram about it. For example, if this is left eye and this is the right eye, right? So she must be having like on the left side and the right side. If I'm seeing from my side, that is what. So maybe she's having defect out here, and for the right she is having defect out here, right? Involvement of which of the following structure would you likely expect to be a reason of bi-temporal hemianopsia? So the options are right optic tract, okay, right optic tract, left optic tract, right optic nerve, left optic nerve. So let me just make a brief diagram for you guys. That is what, for example, okay, this is my, say that, like, okay, let's say this is the left eye of someone and this is the right eye. Again, let me just make the diagram, right? So left eye and the right eye. So what is going on right here, right? Okay, so this is what, this is your optic nerve passing like this. Okay, thereafter we are having the optic chiasm out here, optic chiasm. This is the optic tracts out here, right? So what is happening, guys? For example, let me just make a little bit. Okay, so what's going on? So this is one, this is on the other side. Okay, this is the peripheral vision and this is, let me say, the central vision. So this part is responsible for the this side, and this is responsible for the this side, let's say. For example, again, let me just draw the same. This is for here, right? And what is it saying is, for example, okay, let's start from here. So something like this tract is going, again the same with, okay, not the same, right? No, not right, guys. This tract is going on this way, for example, and now this tract is going from this way, right? Like this, right? Perfect. Right. And now if we think about it, for example, what is the meeting junction of this point, like which is responsible for this vision? Let me say, okay, from this color, okay, from, okay, this part, sorry, that is what, this part, right? So if there is any pathology on this part, what is going to happen, guys? Like the both of this, okay, this is like the, this side of hemianopsia or the peripheral vision, there will be disturbed, right? And this side also, okay, the peripheral vision is disturbed. This is known as what, a bi-temporal hemianopsia, right? So this is basically a complication of optic chiasm. But let me just explain you some other pathologies of the optic tract or the optic nerve also. For example, let me say, if there is, for example, pathology out here, for example, in this part, okay, so what's going to happen here? See, for example, this eye, on the right eye, okay, right eye, we are going to have the complete blindness out here. Okay, so it's what? It's just complete blindness out here, right? Complete blindness out here like this, right? And if there is, for example, any pathology on this side, okay, from the blue, let me make, for example, on this side, so what's going to happen out here? See, what's going to happen is, that is what, again guys, there is something like hemianopsia out here. No, hemianopsia, sorry, just a second. That is what you are, like, no, it's the loss of on the both side, right? It's just like the loss on the both sides also, just like this. Let me show you, right? So the same side, for example, this will be what, the peripheral, the another will be also the same thing like this. Okay guys, I think you got it. You got the basic idea of what's going on. And only, like, the bi-temporal hemianopsia, it is only possible with the complication of the optic chiasm out here, right? And what you must need to do, like, you must remember this diagram, and this is really important diagram as per the concept of eyes, eyes neuroanatomy is related, okay? This is important for that. So okay guys, by this, like, from this last question, we just completed our paper of 2019, and this is Rock the Crook, and let's see you in the next video.